I'm joined here today with Dr. Lauren Harrington, who is the Medical Director of CU Medicine, Obstetrics and Gynecology in Central Park, and an expert in trauma responsive care. To start, Dr. Harrington, can you please explain what trauma responsive care is?
Yeah, absolutely. Thanks. Thank you for asking, and thanks for your interest in this. Trauma responsive care is built on the understanding that trauma can have significant effects on both emotional and physical health. And in a trauma responsive space, there is trust, transparency, and shared power between those who are seeking healthcare and those providing healthcare. The goal is to avoid situations and dynamics that are either re-traumatizing or that create new traumas. Instead, there is a safe space that can promote healing, recovery, resilience, empowerment, and prosperity. Trauma responsive care is particularly important in obstetrics and gynecology. In OB-GYN, one's most private, intimate, and vulnerable moments intersect with scenarios that could potentially evoke or create significant emotional and physical trauma.
Completely agree. What inspired you to bring trauma responsive care into your practice, and what does it look like?
Absolutely. So when I was doing my residency at Stanford, I had a wonderful mentor who introduced me to the idea of trauma responsive care. And once I saw the power that healthcare providers have to either create a safe space or to create an unsafe space, I became steadfast in my commitment to create safe environments for patients and for training the next generation of healthcare providers to do the same. So some key elements to a trauma-informed approach include normalizing and universalizing the discussion about trauma. So I ask all of my patients if there are any prior difficult experiences or traumas that they'd like to share with me. But it's also important to note that patients should not have to disclose a history of trauma in order to receive trauma-responsive, respectful, and consenting care. So we provide trauma-responsive care universally to all patients, regardless of our knowledge about their past. We also aim to empower patients and create transparency by providing education, guidance, and frequent communication. Early in the encounter, I also set the expectation that we do not have to do an exam that day. Many people feel like going to the OB-GYN means that they have to have a pelvic exam, and it leads a lot of people with a history of trauma to avoid seeking care from a gynecologist. So the patient gets to decide if and when we do an exam. If we choose to perform an exam before we start, I explain each part of the exam and why it's important, which is to say what information we hope to glean from each part of the exam and how it would change or inform our management plan. So the patient can choose which part of the exam they're okay with. We also make a plan for comfort. So, for example, wearing fuzzy, comfortable socks or bringing a cozy blanket from home, playing their favorite music, or bringing a support person. We also discuss relaxation and grounding techniques. So in this, I actually often incorporate the patient's behavioral health team or therapist or psychologist, and we make that plan together. And during an exam, throughout the whole exam, I ask permission and frequently reestablish consent. I make it clear to the patient that the patient is in control, and if we choose to stop or pause the exam at any time, that's okay.
Looking to the future, what is your vision for trauma responsive care, particularly in the field of OB-GYN practices?
So I envision, my hope is that in the next 5 to 10 years, a video like this won't exist because trauma responsive care will just be so universal and the standard of care. This won't be something that is new to people or that patients are learning about for the first time. And so I really hope and expect that it will be applied universally and honestly across all specialties. This is not unique to OB-GYN care, right? This is applicable across the board. But the wave of change is already underway. The next generation of healthcare providers are all getting education about trauma responsive care in medical school, in their training. And we know that our patients will benefit from this. Interestingly, data also suggests that this form of clinical practice also minimizes burnout for providers. So it's benefiting everybody across the board.